So, you know, dentistry, forever we have tried to figure out what's going on with dentistry. Why do we have tooth decay? Why do we have gum disease? You know, most of the times a very conscientious patient may come into the office every 3 months, yet they still brush, they floss, they maybe even have had a round of antibiotics, and their gums still bleed and they have new tooth decay. The question would be, what's with that? Most people would take a look at these patients and say, well, you're not brushing hard enough, or you're just not eating the right foods, or you're doing this, or you're doing that. But most people, most practitioners, don't take the time to figure out, or they don't even know where to find the information out as to where this disease, this gum disease and tooth decay really come from. So I'd like to talk to you a little bit about what my thoughts are. We're going to begin with some science and reality of primal societies today. I'm going to discuss what I believe is called the Big Bang Theory of chronic disease. We're going to look at some human studies that were published in the last few years. And then I'm going to talk to you about how we work with patients in my office, excuse me, when I was seeing patients. And then what I believe and where I believe this disease is really beginning, and that is in the gut. I'm also in the process of working with a double-blind study that may prove some interesting facts. We'll go ahead and summarize, and I'll answer some questions. Any questions that you want to ask, I am ready for. You know, I'm dying to speak to you guys. For the last 2.5 million years, if you believe in evolution, assuming that man and woman have evolved, over this last 2.5 million years, but certainly the last 160,000 years, man has hardly had tooth decay or gum disease. They had no toothbrushes, they never had dental floss, they never went to their dental caves to do dental cleaning, they're not layered with fluoride on their roots of their teeth, yet they don't have gum disease. They don't have gum disease or tooth decay because the etiology, the true etiology, has not been prevalent. But something has happened. Something has happened to the way we live, and why? Because the way we live is creating chronic disease, which dental disease, tooth decay, and gum disease is part of. The story really goes back to skeletons. If you can look at the human skeletal remains, let's say 10,000 to 20,000 years ago, you'll see, for the most part, solid alveolar bone and very little structure of the tooth being decayed, maybe the teeth being broken, but not much decay. The reason is that we can look at these skeletal remains and look at the DNA of the calculus remaining. And if we look at the calculus remaining and study the types of pathology or potential pathological species, they are all in a state of balance. Any individual bacteria or bacterium could become pathologic, but when they're in a state of balance, there is no decay and there is no alveolar bone loss. If you look at the years from 10,000 on up to today, there's been a major change in the way that pathology has occurred in the mouth. And the way that pathology has occurred in the mouth has been specifically the way the pathology has occurred in the gut. The more refined, processed, sugary foods, excuse me, and the types of bacteria that live in our gut are creating changes in not only our gut, but throughout our entire systemic circulation. There was a study that was done in early 2010 2010, I think, 2005, that evaluated the college students in the United States. And it showed that 94% of U.S. college students had some form of gingivitis. Another study showed that 47% of adults in the U.S. had active periodontitis. And if you were older than 65, 70% of the U.S. population had periodontitis. That's an epidemic. If you were looking at diseases throughout mankind, these percentages should create an alarm, especially since 10,000 years ago or more, these numbers were almost zero. The World Health Organization has determined that tooth decay is one of the most infectious, non-communicable global diseases. 91% of adults in the U.S. have either active tooth decay or tooth decay that has been restored. Again, our primal ancestors never had these problems for the most part. And primal societies that exist still today hardly ever have these areas of tooth decay. It's not so much what we think we know. This is a humorist who I'm quoting, that shows that we really don't know what we think we know. So what is the real etiology of this disease? I wrote a paper called The Big Bang Theory of Chronic Disease that was published in Wellbeing Journal last year. I cite about 25, 35 peer-reviewed papers that show that chronic disease emanates from the gut. And once it gets into the gut, through the circulatory system, and into other organ systems, it becomes chronic disease. And tooth decay and periodontal disease are chronic diseases. As you know, we weren't born to have rotten teeth. We weren't born to lose bone around teeth. We certainly weren't born with a fluoride deficiency. We were born to be healthy, but disease is rampant. It's like a fire that is burning out of control. You know, if your home were on fire, for example, and the fire trucks were there and they were trying to wet the fire and put the fire out, but you still had a gasoline leak in the garage, the fire will continue. So you're stoking the flames of the fire. And the fire is actually being stoked inside the gut. This is a graphic description of what the gut looks like. The tube from the mouth to the anus is one continuous external tube in the body. It's not internal to the body until the membrane is pierced and the circulatory system is entered. And when these little cells that line the gut, these epithelial cells that line the gut, are damaged, there is a process called a leaky gut or increased intestinal permeability, where antigens and other unhealthy byproducts from bacteria and a variety of other factors leak into the blood system and become systemic. This is the fire that leaks from the gut into the circulatory system is what's causing this chronic disease. So the unfortunate thing is I just can't tell you, eat this type of food and you'll be healthy, or take this kind of antibiotic or you'll be healthy. That's not the way it runs. The foods that we eat that are contaminated with chemicals, the foods that we eat that are genetically modified, prescription drugs, over-the-counter drugs, all sorts of toxic substances, many of which dentists are part of putting in the mouth, antimicrobial mouthwashes that kill not only some bad bacteria, but a lot of good bacteria, dirty electromagnetic fields, unhealthy lifestyles. All of these factors contribute to what may cause a change or a damage in the gut. Once the gut is damaged and the bacteria are damaged and the lining of this gut epithelium is pierced, then you can develop, and you do develop, chronic systemic inflammation and a variety of changes in the mouth. So we can get healthy. Again, we just need to understand this Big Bang theory that I believe is at the core of everything. For example, irritants in the environment, like glyphosate and chemicals, are highly irritating and caustic to the epithelial lining of the gut. Dysbiosis is a term where the normal bacteria of the gut become out of balance. Any one bacteria could become, or any one bacterium could become pathologic, but in its overall balance, they're not pathologic. The layer of mucus that surrounds the epithelial lining that goes around the lumen is hugely responsible for the immune system and the potential for any infection or any inflammation getting into the bloodstream. The dirty electromagnetic fields and pathological bacteria will affect the mucus layer. This layer, this mucus layer and the epithelial layer, eventually will activate the immune system to create a variety of cytokines that pour into the bloodstream. And once these irritants affect different organ systems, and based on your genetic code, you could develop some type of breakdown, which would cause chronic disease. This is a more complicated picture of what the lumen looks like. And the picture on the left, or the part of the slide on the left, is showing pretty normal bacteria in the gut flowing through and around the epithelial lining. The picture on the right depicts a breakdown in these epithelial cells and some of these irritants penetrating into the circulatory system, creating inflammation. One of the reasons why the gut is actually the center of the cause of chronic disease is that all mucosal tissues talk among one another. In other words, they perform crosstalk. They actually communicate one into themselves. The epithelial cells, the cells of the gut communicate with the cells of the lung tissue and all other mucous membranes. Also, your genetic disposition allows your body to be more susceptible to some of this crosstalk. Once the host resistance is compromised because the actual inflammation is starting to affect your body's ability to fight infection, the actual bacteria start to change, and the bacteria change again first in the gut and then eventually in the mouth. If you were to have a healthy gut and none of these irritants that I suggested before would be part of this gut problem, then the bacteria, which is around about 700 or so species in the mouth, would be in a state of balance. As long as the bacteria in the mouth are in a state of balance, they're healthy. Dental plaque is healthy until it's not healthy. And we'll talk a little bit more about that. What happens is we develop a vicious cycle. Once there is dysbiosis in the gut and the bacteria in the gut are affected and other irritants in the gut are causing more problems, the systemic and chronic inflammation affects the mouth. Once it affects the mouth, for example, in periodontal disease, there's bleeding of the gums. This infection gets under the gum tissue and it starts to leak into the circulatory system, just like a damaged gut bacterium and other irritants leak into the circulatory system. So you now have at least two nituses of infection. You have the main nidus of infection in the gut, where the bacteria are out of control, although you may not realize it, and periodontal disease causing a variety of cytokines and irritants and remnants of bacteria filtering into the bloodstream and becoming systemic. I want to go over a few human studies that I believe really can help a patient understand some very practical ways to change the gut and change the health of the mouth. One study was done in 2009 by Dr. Baumgartner. It was an interesting study because he took 10 people in Switzerland, and these 10 people could not brush or floss for 30 days. They had to eat the foods that were endemic to the area about 5,000 years ago. Before the study started, there were bacterial studies done on the tongue, bacterial studies from the plaque under the gum tissue, and also bleeding on probing. At the end of 30 days, statistically, the bacteria around the teeth, without brushing and flossing, increased significantly, but there were no unhealthy balance of bacteria in the mouth. In addition, the bleeding actually decreased and pockets decreased. Mind you, these people could not brush or floss for 30 days. Another study was actually a paper by Dr. Scheinman, who showed that sugar is the critical element to cause the breakdown in acids below a pH of 5.5 to create tooth decay. If we didn't have free sugars, these are sugars added to food, not necessarily the sugar in a banana or sugar in a strawberry, but the sugar like the powdered sugar you might put on a strawberry, those sugars would create the acid environment, creating tooth decay. If the sugar acid environment was not there, tooth decay would not be a problem. Another study that was done by Dr. Johann Wolber in 2016 was a double-blind study. He took two groups of people, both of which had active periodontal disease, both of which ate very unhealthy foods. The control group was actually allowed to brush their teeth, but they could not floss their teeth. The experimental group could still brush their teeth, but they would not floss their teeth, yet they had to change their diet to a non-inflammatory diet, basically eliminating grains and processed foods. The experimental group that ate the healthier diet, that could not floss but could brush, had significantly less plaque, significantly less pathologic plaque, and significantly less bleeding on probing compared to the other group who could floss, but they could not eat a healthy diet. The healthy diet was the critical component that changed the pathology of the bacteria. Dr. Wolber also repeated this experiment in 2019. I think he either doubled or tripled the size of the experimental and control groups. The bottom line is this: if the diet is made such that it does not provide the chemicals and the over-processed foods and the free sugars that actually created a dysbiosis in the gut, then there would not be a dysbiosis in the mouth. So when I see patients, and when we were working with patients to try to educate them, my interest was, how can I help patients not only understand what's wrong, what's not good to eat, I needed to help them understand what they could substitute so that they weren't deprived of their foods that were satisfying. So we talked to our patients and tried to work things through in an efficient manner. We needed, obviously, to treat the acute disease and educate the patient. We wanted to obviously treat and have patients understand that dental plaque could be unhealthy if the pathology was out of balance. So certainly they needed to understand and demonstrate efficient oral hygiene. And we needed to repair the damage in their mouth. But none of this actually addressed the foods specifically. So we prepared a 3-day food journal. 3-day food journal is nothing more than a journal that a patient would jot their detailed notes down about what they ate for breakfast, lunch, dinner, and all snacks. What we really were looking for specifically were the 3 most irritating, inflammatory foods that they could eat that would damage their gut and eventually cause tooth decay and gum disease. And the 3 types of foods would be free sugars, as I mentioned, sodas of any type, and grains of any type. All of these foods produced a variety of irritants to the gut. It provided a variety of acid and caused the pathological bacteria to overgrow. So what we then did was take another journal, and where they particularly specifically identified the unhealthy foods they ate, we filled in substitutes that could be ideal to eat. In other words, instead of drinking soda, they drank water or Perrier. Instead of drinking grained products, they could eat paleo-type bread or other types of products that didn't contain the gluten types of breads. And of course, sugars, not adding sugars to foods. So what I mentioned before is that we have 2 nituses of infection. One is the leaky gut, and one is the leaky periodontal pocket. In my opinion, from the research I've done and the research I'm currently involved with, I see that the gut is the source of this initial problem. But once the bacteria and the host resistance and the immune system start to break down, the mouth is the secondary nidus. If you were to treat just the mouth and not even understand the gut and the changes in the gut, you would never treat periodontal disease or tooth decay completely. If, on the other hand, you were a functional medicine doc and you only treated the gut and you had no idea what periodontal disease was, and you only treated the gut with a variety of products, you still would not be able to treat the periodontal disease, because once it got under the gum and became its own nidus of infection, it needed specific treatment. So both would need to be treated at the same time. So in my way of thinking, we need to understand how to get the gut healthy. So we need to remove inflammatory foods and toxic substances, as I mentioned. But we need to rebuild the gut with healthy bacteria. There are so many types of brands of probiotics, for example, that are out there that supposedly will help reestablish new and healthy bacteria in the gut. But some of the science is showing that the only bacteria, the only probiotics that actually grow new bacteria in the gut, as well as produce chemicals and a variety of byproducts that are helpful for the gut, are what's called spore-based probiotics. Spore-based probiotics live in the dirt, in the earth, and they don't germinate until you ingest them. There was a study that was done in 2005 that studied 35 different brand name probiotics. And these probiotics were taken by mouth, and during the course of the study, the activity of these probiotics could be evaluated all the way to the colon. It turns out that all 35 strains of these, or brands of these probiotics, were completely destroyed in the stomach acid of a pH of 1. And that is a protective measure of the body. If we as humans were to eat constantly bacteria, and we didn't have some means to destroy potentially unhealthy bacteria, we would die the day after we started eating the bacteria. So the stomach acid is a critical barrier to kill bacteria, but not just bad bacteria. The stomach acid is indiscriminate. It's going to kill all bacteria for the most part. But the unique thing is that spore-based bacteria, which are bacilla spores, actually are resistant to the acid in the stomach, and they actually begin to germinate in the gut. So they not only develop new and healthy bacteria in the gut, they actually help the existing bacteria in the gut to populate and regenerate. So in my mind, and from my research, spore-based probiotics are the ideal type of probiotic to help supplement the gut. In addition, I'll go back one slide. In addition, we want to feed these bacteria with fiber, which are called prebiotics. And prebiotics are basically the fibers that are not digested by the body, but they're digested by the bacteria, and they're mainly in vegetables. Right now, I'm involved with a double-blind study that we're evaluating a variety of spore-based probiotics combined with vitamin K2 and to see if just taking 2 capsules of these probiotics without changing lifestyle, without changing toothbrushing, flossing, no other changes other than the probiotics, if we can actually enhance the immune system, improve the mitochondria of the overall body, and actually enhance the bacterial composition in the mouth by reducing the bleeding on probing. It's a 6-week study that we're using right now, and these are the particulars that I just mentioned that we're looking for. So basically what I want to mention and what I want to try to summarize: gum disease and tooth decay are preventable, reversible, and curable. And most dentists will tell you that's not true. I'm going to tell you I think it's true. And I can tell you that my patients that follow my regimen will tell you that it's true. Gut health is critical. If you eliminate or avoid a protocol, a lifestyle that supports healthy gut bacteria, then you're prone to a variety of chronic diseases in the future. And unfortunately, chronic disease doesn't occur within a week or a month or a year. You could be eating unhealthy foods, but it could take 10, 15, 20 years for the disease to manifest. And it doesn't have to be gum disease or tooth decay. It could be multiple sclerosis. It could be Alzheimer's. It could be cardiovascular disease. There's so many diseases that are the direct effect of chronic systemic inflammation. Nutrition is 90%, nutrition and lifestyle actually are 90% of the actual manifestation of a disease. even if you have a 10 or 15% genetic predisposition to some chronic disease, if you are aware of the nutritional and lifestyle changes that you can make, you could prevent and cure yourself from these chronic diseases if they hadn't taken hold significantly. The bottom line is decrease chronic inflammation and you'll decrease chronic disease. And there's no better platform to teach these types of methods of preventing chronic disease than a dental office. We see patients all the time, their mouths are open all the time. We can tell them and show them and demonstrate what they need to do to really have a healthy body and a healthy mouth. So guys, that's me. If you have any questions, I'd love to answer. I'm sorry my throat is a little choppy. Hey, I'm good.
Concentration and the amount of sugars that man has continued to make plentiful. So if you go back, I know you had 170 years ago, but for all intents and purposes, 100 years ago, do they have examples of skulls that are younger? I mean, where you have
Actually, yeah, there are interesting skulls that were like 16,000 years ago. And what happened was there was a primitive society that actually ate beeswax. You know, they'd gather bee honey and they'd chew on the wax. And they would do that for 30 days, 60 days while they were hunting. And it turned out that they actually developed quite a bit of tooth decay. There was another group that, in a similar way, they used some type of a nut, a nut that they churned and fermented that create a significant amount of sugar. And the problem was, it's the way they made it, it was processed. But what was happening was this sugar was created in the very sticky material that it was made from, and it just sat on the teeth. So the sugar actually changed the acid. And once the acid was changed, that was the beginning of the tooth decay problem. And then it becomes a vicious cycle because the sugar affects the bacteria in the gut, and then it goes back and forth.
How you doing?
I am great. Can't you tell?
Lying down on the job.
I am.
I have a question for you. There's a product called Restore out there, which is supposedly to help leaky gut. You know, I think it's a humic and fulvic acid. Do you have any comment on that for sort of helping to heal the gut?
From what I am gathering, Restore helps to offset some of the damage of glyphosate. So glyphosate is an interesting product which is used in all commercial farming today, unfortunately, and it's used to kill weeds and a variety of things, but it gets into the epithelial lining and creates increased intestinal permeability. In that sense, it may work to some extent, but it's more of a go-around. The way I would see it, it would make much more sense to provide our genetic code with what it really needs, rather than use one chemical offsetting another chemical to try to offset another chemical.
And that having been said, what are some of the the root vegetables or spores that we can get naturally just from our foods that can help heal our guts?
Well, all fruits and vegetables are good. Leafy green veggies are even better than fruits because of still the concentration of sugar. And I would not say that there are any specific ones that you should use, but I would use a variety of fibers. Now, there are commercial products that are made from a variety of naturally occurring fibers. They're good, but go to any grocery store. You certainly want to only eat organic foods because of the residual chemicals of pesticides and herbicides. But I would not be specific on the type of fiber other than get a lot of it.
Okay, and last, how about your capsules? Where are those available? That you can swallow a capsule that has the good probiotics in it.
I'm not sure if I can tell you the name of the company we're working with, but I will. So I'm using Megaspore Biotic, which is from Microbiome Labs, but that's not the only company that does that. There's another company called Enviromedica, which makes spore-based probiotics that are also excellent. So if you wanted to select 2 different brands, they are excellent.
Well, thank you very much.
You're welcome.
Dr. Danenberg, first of all, thank you very much for your presentation, and God bless you in your journey. I have 2, points of interest if you would speak to. One was I was very curious about your use of K2 or the active form MK7.
Yes.
If you would speak to that. And my other comment was if you would speak to xylitol as a prebiotic.
Okay. So vitamin K2, MK7 is interesting because some of the research maybe published in 3-4 years ago shows that gingivitis is actually a disease of mitochondrial dysfunction. And if you go into the depths of the research, you'll find that almost all chronic disease is a disease of mitochondrial dysfunction. Then some of the research that was specifically reported showed that if gingival fibroblasts were exposed to LPS, which is the very bad part of the bacteria in P. gingivalis, then if you could repair the mitochondria, even in the presence of LPS, there was no bone damage. There was no cytokine reaction creating an overproduction of reactive oxygen species, creating the bone loss. And vitamin K2 does actually enhance the protein change, the ATP production from complex 1, 2, 3, and 4, and has been identified as a potential treatment for mitochondrial dysfunction. So that's one of the main reasons I wanted to include that along with the spore-based probiotics.
Great, thank you very much. And if you would comment on any
xylitol.
comments on xylitol as a prebiotic?
Okay, so xylitol can be a prebiotic, and that's a fact that is good for some people, but a lot of people do not respond well to xylitol because it's a sugar alcohol, and it creates a variety of irritation to the gut, me being one. And I will just leave you with one question, and that question is, why do you want to kill all this good dental plaque? You're not answering me. So let me give you an answer. Let me give you 3 answers. Dental plaque is healthy until it's not. And we can look at human remains, and we know that all this calculus around the alveolar bone is there. It is all bacteria, but the decay of the teeth are not prevalent, and the alveolar bone loss is not prevalent. The bacteria in the dental plaque, when it's in balance, produces its own hydrogen peroxide. The variety of species produces its own variety of peroxide that kills off other potentially pathogenic bacteria. Dental plaque also acts as a gatekeeper for the biologically active minerals in the saliva that slowly penetrate the plaque to get into the root surface to remineralize that tooth surface 24 hours a day, 7 days a week. The other thing is that it helps to maintain a pH that is above the 5.5.
Sure, thank you for that. I was of the understanding or impression that xylitol will bind up bacteria, virus, fungus, and parasites and just exists in harmony with healthy bacteria, that there's no interaction between xylitol and healthy bacteria.
Well, my understanding is that xylitol helps to prevent the pellicle from forming, and if the pellicle is not forming, you're not getting the natural production of dental plaque.
Well, thank you for that. More food to ponder. Thank you.
You're welcome. I really enjoyed it. Thanks for the opportunity. Obviously, this is a unique situation. I've never done this before in my life, right?